I'm here to talk about my client, Jude St. Francis, and his diagnosis according to the DSM-5. Jude St. Francis is a 53-year-old Caucasian male living in New York with his best friend, Willem. He's a successful lawyer and he is not married. His developmental and medical history include being found abandoned at a monastery when he was a newborn, so his biological parents are not known. He is unaware of any pre- and postnatal complications. As a youth, he was hit by a car. This accident left physical disabilities, peripheral nerve damage, and reoccurring sores on his legs. The reoccurring sores on his legs led to osteomyelitis, which is a bone infection. Due to the open sores in his legs and a compromised immune system, these sores ultimately led him to require amputation of both of his legs, leaving him stuck in a wheelchair. Him being stuck in a wheelchair contributes to his feelings of shame and helplessness. He also had a UTI as a youth, which left physical damage. His family history includes being abandoned at a monastery. He does not know his biological parents. He endured physical and sexual abuse from monks at the monastery. He was abducted by Brother Luke, a monk he had come to trust very much. Brother Luke used him for child prostitution to make a profit. This is when he began self-harming. He was abducted by Dr. Traylor after being found by police and taken from Brother Luke. Dr. Traylor physically and sexually abused him. When he tried to escape from Dr. Traylor's house, Dr. Traylor hit him with a car. This attack is what led to Jude being ultimately stuck in a wheelchair. After he was hit by the car and escaped from Dr. Traylor, an evangelical Lutheran Douglas family fostered Jude while he was recovering from his injuries. Jude's social history includes having little to no friends until college. In college, he became friends with Willem van de Beek, who he is now living with in New York, John Baptiste J.B. Marion, and Malcolm Irvine. The four became very close and hung out constantly. Jude St. Francis became extremely close to his professor Harold at Harvard as well, and was later adopted by Harold and his wife Julia. Jude reports that he considers Andy Contractor, his physician that he regularly sees, a close friend as well. Substance and legal history is very limited. He reports no use or experimentation of drugs, and there is no documented legal history on Jude. Now, his diagnosis. According to the DSM-5, Jude has complex PTSD. PTSD, also known as post-traumatic stress disorder, is a mental health disorder that occurs after exposure to actual or threatened death, serious injuries, or sexual violence. Now, Jude has complex PTSD because of the repeated and prolonged trauma from his childhood, which also stems from his refusal of therapy. Symptoms of PTSD include intrusive memories, changes in mood and thinking, avoidance, and feelings of guilt and shame. Why PTSD? As a child, Jude was subjected to many types of abuse from many different caretakers, as well as he was used for child prostitution. His traumatic childhood ultimately shaped his life and has caused years of extensive mental health issues. One requirement of PTSD is avoidance of any kind of stimuli that may be a reminder of a traumatic event. Jude exhibits this by avoiding any kind of physical touch. Even from the people that he knows and trusts and care about, he still does not want to be touched by them. Another requirement of PTSD is an intrusion symptom. Constant nightmares about what he faced as a child is an intrusion symptom that he faces. These nightmares are mostly about the physical abuse that Jude faced as a child. Negative alterations in cognition and mood are seen by Jay's constant depressive state and sense of shame. These feelings of depression and shame have led to Jude turning to self-harm as his main coping mechanism. Feelings of self-hatred and shame hinder Jude from experiencing any positive emotions like happiness or joy. Even when he's doing something he enjoys, he does not feel any sort of happiness. The last requirement is marked as alterations in arousal and reactivity. Jude exhibits self-destructive behaviors and sleep disturbances. Even with all the emotional and physical damage that he faced in his childhood, that he is still facing from his childhood, he refuses any kind of medications or therapy to help with these things. Due to his refusal of help, his symptoms have lasted decades. Even though he's 53, he's still experiencing the same things that he experienced as a child, right after his trauma happened. My theory for Jude is Jude's history of severe abuse, neglect, and abandonment from his parents and other guardians has profoundly shaped his adult relationships, self-perception, and behaviors. A psychodynamic perspective is how early experiences influence current functioning and emphasizes bringing unconscious material to awareness so healing can occur. Jude has a real problem with suppressing all of his emotions and memories, so this theory will help him bring those things out so he can begin healing. The first intervention that I would give to Jude is free association. Free association is when the client is encouraged to verbalize thoughts, feelings, and memories. For Jude, whose coping mechanisms are secrecy, self-harm, and emotional withdrawal, free association would create a space for repressed memories and feelings, and he would make a space for these things to begin to surface safely in a safe environment. Since Jude often minimizes and hides his pain, both physical and mental, this intervention could help uncover the subconscious guilt, shame, and fear that are driving his self-destructive behaviors, like his self-harm and his suicidal actions. With the therapist's guidance, Jude could start to make connections between his past traumas, everything he faced as a child, the abuse and the prostitution and everything, and his present difficulties that he is still dealing with, both physical and mental, such as his inability to trust people or accept love. He could work through these things with free association, having a safe space to bring out all these emotions that he has been bottling up for so long. The second intervention that I would give to Jude is interpretation of transference. In psychodynamic therapy, transference occurs when a client projects their feelings from past relationships onto a therapist. Given Jude's deep untrust of others and tendency to fear abandonment, these dynamics would likely appear in the therapeutic relationship between Jude and a therapist if he chose to ever go to one. By gently exploring these reactions that he has when putting his trauma onto the therapist, the therapist can help Jude recognize how his early relationships continue to influence his current relationships and his current emotional responses to those relationships. For example, if Jude fears the therapist will reject him after he shares something painful that he went through as a child, processing that fear of being rejected could help Jude understand how his past abusers shaped his expectations of love and safety, and how he is projecting that onto his current relationships as well from his childhood. Both of these interventions aim to help Jude gain insight into his unconscious conflicts that he's facing inside of himself, and process repressed emotions and develop a more compassionate understanding of himself. By bringing his hidden pain into awareness within a safe and consistent therapeutic relationship, psychodynamic therapy could offer Jude the opportunity for deep emotional healing and self-acceptance to help him work through some of those traumas that he faced as a child. So, to review. Character review. Jude St. Francis is 53, a white male living in New York with his best friend Willem, who he's been friends with since college. He maintains relationships with Harold and Julia, his adopted parents, and his doctor, Andy Contractor, who he regularly sees. He suffers with severe mental and physical health issues, all stemming from extensive childhood trauma, including abandonment, physical and sexual abuse, and childhood prostitution. These things, all these traumas, led to chronic pain, self-harm, suicidal thoughts and actions, and deep feelings of shame and unworthiness. Jude physically suffers from permanent back and leg injuries, nerve damage, and osteomyelitis, a bone infection, which led to both of his legs being amputated, leaving him reliant on a wheelchair, which contributes to all of those feelings of unworthiness and shame. Although Jude attends regular medical appointments with his doctor, Andy, he refuses meds and therapy to help with these traumas, and he conceals his past out of fear of rejection from everybody around him. He does not share anything about his past with anybody he knows. Despite his traumatic history, he has built a stable career and close relationships. Diagnosis review. Jude St. Francis can be diagnosed with complex post-traumatic stress disorder, PTSD, due to his history of severe childhood abuse, neglect, and trauma. Jude's symptoms include avoidance of physical touch, even from those he trusts and cares about, reoccurring nightmares, mostly about the physical abuse that he faced as a child, chronic shame, depression, self-harm, and sleep disturbances, as well as suicidal thoughts and actions. Despite his great success as a lawyer, Jude's unresolved traumas continue to affect his emotional well-being and his relationships. Using the psychodynamic approach, his present struggles can be understood as stemming from unconscious conflicts and unresolved childhood trauma. 2 recommended interventions are free association and interpretation of transference, so that he can release those feelings that he has kept inside of himself for so long. Through these methods, Jude could begin to process his pain, gain insight into his behaviors, and move towards healing and self-acceptance. Thank you.